The character we'll be discussing is named Dr. House from the show House. He's a middle-aged man working at Princeton Plainsboro Teaching Hospital, where his boss only puts up with him because he is the best doctor in the clinic. Proving such, he has a trained team to help him handle any strange cases he might encounter. Also, he is a rude scruff and has a limp, so he constantly takes painkillers. Dr. House speaks to everyone rudely and abruptly, and with no personal thought. Also, he instructs his hand-picked team that everyone lies. With this mindset, House has maybe made one friend. The best way House likes to annoy the head clinic doctor is by avoiding treating day-to-day walk-ins and by taking patients with abnormal and seemingly undiagnosable problems. Dr. House shows symptoms of narcissistic personality disorder. This falls under the DSM-5 category for personality disorders, the requirements of which are grandiose feelings of self-importance, lack of empathy towards people, and the need for admiration. Other symptoms can include limitless fantasies, belief of superior uniqueness, need for entitlement, exploiting others, arrogance, and being envious of others' opinions.
Dr. House displays these symptoms in several ways, the first of which being his severe lack of people skills. He shows an anxious, ambivalent relationship style with many of his coworkers and any romantic interests. He shows no signs of caring for his patients or connecting with them on an emotional level, and he is often brutally and even rudely honest. Also, Dr. House tends to unknowingly create chaos when he avoids direct contact with his patients and ends up glossing over necessary information needed for diagnosis. He is also controlling and jealous and often lies to manipulate his employees or those around him. However, not only are his lies manipulative, but so are his brutal truths. Another symptom that Dr. House displays is his attitude of self-importance. He often says things such as, "I am always right," or that he is too important to see patients that he deems boring. He has been seen to choose his own staff for non-professional reasons, and this led us to diagnose him with narcissistic personality disorder, which he should seek help for if he actually cared about getting better. The show portrayed Dr. House's disorder relatively accurately, give or take a couple symptoms. Dr. House is shown to be uncaring and arrogant, with little to no empathy towards others. He very often exploits those around him and believes that he is better than them. However, Dr. House does not display envy of others' opinions, as he simply doesn't care what others think.
Treatments for those with narcissistic personality disorder include psychotherapy, cognitive behavioral therapy, family therapy, and medications. The treatment plan for Dr. House should be cognitive behavioral therapy. In these therapy sessions, House will be able to discuss his issues without being judged. This therapy could last for several years, but the outcome will be a healthier and more positive behavior. Cognitive behavioral therapy is used for people with narcissistic personality disorder in order to help them have a more realistic view of themselves and others. The only issue with cognitive behavioral therapy is that it is said to work only on well-educated patients. However, this treatment should still be successful as House is an expert in his field. The only difficult question is whether or not the doctor will submit to someone else's treatment.